if you notice any leakage when you're not feeling like you're urinating as a pregnant woman, pop a pad into your panty and contact your midwife or doctor looking after you in pregnancy. That will truly help. Hello and welcome aboard JulieCity. How are you keeping? I hope you're keeping well and safe. As usual, I'm always excited to be here, and I'm glad you are here. So in today's video, we are going to continue with our pregnancy care series, and today we will look at oligohydramnios. Oligohydramnios. Yeah, another big terminology. But as usual, we'll keep medical terminologies as far away as possible from this video, and if I use any, I will definitely explain it in a layman's term. Let's get started. So oligohydramnios simply means when the amniotic fluid is lower than normal during a gestational age of a baby. In my previous video, we established that amniotic fluid will be called the water that surrounds the baby. So I will define oligohydramnios as when the water that surrounds the baby in the womb during pregnancy is lower than normal for the age of the baby at the time. Amniotic fluid, or that water that surrounds baby, is very vital. It is crucial for protecting the baby from infection, from any hard impact. It helps the baby stretch and move and promotes development. It helps baby practice swallowing and weeing and all of those good stuff. Now, the amniotic fluid begins to increase from 33 weeks gestation of pregnancy. And by the time you get to the 40 weeks or term, it kind of should be round about 500 mils, as research says. But this varies for every woman and every pregnancy, but approximately 500 by term. So anything lower than normal within this gestational age period is what is known or described as oligohydramnios. So if at any point when measured, that water is lower than expected or than it should be, there's always call for concern. But it's always important to realize that that concern depends on what stage this reduced amount of fluid occurs. If it happens at term, that is from 37 weeks and over, it's always straightforward and it will be promoting the birth of the child. However, whatever decisions that will be taken will always be based on your consent. And that is one of the reasons I take time to make these videos, and I encourage you to search and seek knowledge so you will be in the best position to make that life transformative decision for you and your unborn child. Knowledge is power. So the next question will be, what are the signs and symptoms, or how is it diagnosed? Now, there are sometimes no significant signs and symptoms. However, if at any stage in your pregnancy you begin to notice a leak or a release of your amniotic fluid, it's very important that you speak to your midwife or doctor looking after you in pregnancy. Very important. Contact your midwife, put a pad into your panty and go over for a check. That way, the pad will be able to show us volume or color. That will truly help the midwife and the doctor for the assessment and will also help you make the best decision at the time. So reduced amniotic fluid or oligohydramnios is mostly diagnosed first with the leakage. You observe the leakage and mainly via the ultrasound scan, which I will also mention is your choice. But informed decision obviously means that you understand what should not, and make the right decision for the way forward. Again, this is one of those conditions that its management will be on an individual basis and on the gestation of the pregnancy. There is no definite cause for oligohydramnios. However, there are a few things that have been listed. The release or the breaking of the amniotic fluid before labor, poor growth development, problems with the placenta, any congenital abnormalities with either swallowing or the renal system, infection. In the case of twins, if there's a twin-to-twin transfusion, so one twin is getting more nutrients than the other twin, that's what is known as a twin-to-twin transfusion. Any maternal condition like diabetes, hypertension, and any other condition that might impact pregnancy at the time. That's why it's important to attend your antenatal appointments and seek information diligently. Also, something as simple as dehydration can cause oligohydramnios. So we encourage you as a pregnant woman to make sure you hydrate adequately. The management or treatments that will be offered will depend on the cause of oligohydramnios. So if it is something like dehydration, then the woman will be encouraged to stay hydrated. And depending on how low the amniotic fluid is, things that can be suggested could be even coming into the hospital to get hydration of fluids, IV fluids. If it is that extreme, it could be infusing or adding to the amniotic fluid through a procedure that will involve injecting some saline into the amniotic sac to increase the volume. It will differ from person to person, situation to situation. Please don't panic. Just stay informed so you can make the right decision at the time. Again, it also depends on the gestation of pregnancy. So if a pregnancy is already at term, that is from 37 weeks and above, then a discussion will be held with you by all the significant professionals, and you'll be able to decide what way forward. It will be more of encouraging the birth of a baby, trying natural ways of inducing labor, actually offering an induction of labor, or even cesarean sections. Again, it will depend on the severity, the cause, and the gestation of pregnancy. What you need to do is be empowered using the brain's acronyms, the benefits of the decision, the risk involved, what are you feeling or what is your intuition telling you about this situation now. Remember to trust your instinct. Do you need more time to make the decision, or do you want the space to make the right decision? Like I said, whatever offer you'll be given will depend on the circumstances on ground. The other things that could be offered also to facilitate safe birth will be prophylaxis antibiotics. The medical team will offer some antibiotics, especially if it is more than 48 hours since the breaking or the release of the amniotic fluid, to protect you and baby after baby is born from prolonged stay in the hospital or from infection. Remember, the amniotic fluid or that water helps to protect the baby. So when that water is gone, the longer it is gone, the likelihood of having an infection. So that's where the antibiotics comes into play. Also, if that pregnancy is somewhere before term, say about 28 weeks, a steroid injection could also be offered as a way of preparing the baby's lungs for life after, because before term, the baby's lungs might not be ready to cope with the work of being out here in our own side of life. So with that steroid injection, it helps to prepare baby's lungs for life after birth. Sometimes it might be a case of do nothing, especially if it's only a mild case and if it is closer to term. You might be offered frequent appointments just to make sure that things are not getting out of hand. And if at any point there are further concerns, then you have more options offered you to make the best decision for you and your baby. There is no decision that can be taken without you, except in the case of safeguarding. So today, one thing you can take away from this video is the BRAINS acronym. It does make decision making easier. I hope you found this video useful. I appreciate your watching right up to this time. Don't forget, if you found the information in this video useful, like this video, leave me a comment or a suggestion, share your experience in the comment section. If you have not subscribed, then I will encourage you to click that subscribe button and share to those you know who gain value from watching this video. Until I see you next time, don't forget, your health is your wealth. Bye bye. Click on those videos popping up. I'm sure you find them useful. See you in my next video. If you notice anything unusual with your pregnancy, contact your midwife or doctor looking after you immediately. It is better safe than sorry.